I hope so. Hello, can you hear us online?
Yes, we can hear you.
Awesome, awesome. Thank you all so much for joining us this afternoon. We are ready to get started. I believe we are 1 or 2 minutes behind. So we shall get going with our Rotary Crepes, which will be led by our secretary.
Good afternoon.
Good afternoon.
Heavenly Father, we gather here today to reflect on our Rotary mission. We thank you for the opportunity to serve and make a positive impact in the world. May our prayer remind us of our commitment to this noble cause. Amen.
No jokes.
No water, no nothing to drink. All right, apologies, like technical difficulty here. I think we're getting there. All right, so our loyal toast would be led by Rotarian Deborah. Is Deborah online? Nope, Deborah is not here. So please raise your glasses with me to the King and the Commonwealth of the Bahamas.
Hey.
And Commonwealth of the Bahamas. Thank you very much. You may be seated.
Good.
Only 1 minute. All right, welcome to the first meeting of this Rotary year 2026-2027. As you can see, we're still ironing out some bugs, but happy to see a few persons present here in the room. And I see we do have a number online as well. So do we have any visiting Rotarians? I don't think we have any in the room. You're not a Rotarian, right? Okay. Any visiting Rotarians on the line? Can you see, President? Any of those are visiting? Right there, didn't see on the side. Those are all the persons, all right there. So just do the arrow down. Nothing if they're any. They're all our members. Okay, looks like there only are members online. So I see we do have a visitor in the room. Jamie, I believe she walked in with you. Yes.
My guest today is a very this is a celebrity.
Really?
Yes.
Oh.
They want some photos and autographs later. But this is with you. Radishka gift.
Thank you for joining us. So is this a prospective or just a guest today?
It's just a guest.
Okay, we're gonna work on that then. Thank you, thank you. We're so happy to have you here. Make sure we get our photos and our autographs before you leave. Thank you very much. Okay. Yes.
PhD Karen Pinder is online. I don't know why we didn't acknowledge her. I think her audio might not be working.
Ah, okay, yeah, because no, I didn't get a response. Okay, well, thank you very much for joining us, PhD Karen. Always lovely to have you here at the club. Anyone else, Sheila?
No, just members apart from that.
Okay, okay, all right, thank you very much. So to get us started with this Rotary year, you saw our secretary had posted in the chat just some information about what it is to be a Rotarian. and you know, how we are different, good, in a good way, all right? So I have put some cards on the table so that we can have, you know, just a reminder of some of those things. Treasurer Catherine, I see you already looking at one. Can you read it out for us, please, so we can hear it? Loud enough so they can hear it online too, please.
Difference between a normal person and a Rotarian. Normal person lives for self and family. A Rotarian lives for self, family, and society.
All right.
Service to others is the rent you pay for your room here on earth. Let's join Rotary for serve for nation. Service, fellowship, leadership.
Thank you, thank you, thank you, thank you. Here, Joan or Dottie, either one of you, there's a card. Jamie, can you pass them the card? Do you see it? It's on the other side there. Unless you want to read it, Jamie.
Let Dottie
Okay.
stand there.
All right, let me let Wayne read while you're doing that then. Wayne, there's a card right in front, right on the table there.
What's through?
You see it right there by the must? Yes. Thank you. Can you tell us what your card says, please?
Difference between normal person and Rotarian?
Yes.
Okay. Normal person sees problems and complains. Rotarian sees problems and finds solutions.
Excellent. Thank you, thank you, thank you. All right, Dottie?
A normal person spends free time in personal interests. Rotarian spends free time serving humanity.
Very true. Thank you. And Danny, I believe you have a card online. Can you hear us, Danny?
Yes, sorry, I do. A normal person works for personal growth only, and a Rotarian works for personal growth and leadership to serve better.
Excellent. Thank you. Thank you. And before we call on our president to bring us remarks, I believe you have a card as well, ma'am. You need your glasses too?
Sorry.
Someone want to volunteer? Oh, wow. Deborah, you want to read it for her then, please?
Yeah.
You need glasses too?
I don't think so. What am I reading?
Can you see it?
Yeah, a normal person thinks about me. A Rotarian thinks about we, one for all and all for one.
All right, thank you, thank you, thank you.
Thank
So
you.
those, I think, are some good pointers for us as we go into this Rotary year, you know, as we think about how we are, you know, going about our daily lives. Okay, so remember those. If you need copies of them, we have them, we can share it again. And with that, Madam President, I shall call on you to give your remarks.
Good afternoon, fellow Rotarians and guests. It's a pleasant day outside, and it's a pleasure to see all of you all in the room and online. I'm excited. It's a new year, and we're gonna have lots of fun. And I just want to share with you that next week, Tuesday, there will be a closed meeting. It'll be a club meeting, and some information will be emailed out to you this week, so you can peruse it and see what's coming up and what will be discussed. And we will also be sending out the bylaws for you to review for any changes that may be agreed to at the meeting. We'll also have clarification of the invoice and the dues that were sent out. And we will also discuss what changes will be taking place at Rotary Club of Nassau. So it's going to be exciting, a lot of information to share, 1 or 2 new changes, of course, with your approval, and just enjoy the meeting. Thank you.
Great. Thank you. Thank you very much. So before we get into the meat of our meeting and talk, so we can hear from our speakers, we'd like to get our Rotary minute from our secretary.
Good afternoon again. Our Rotary Minute focuses on Rotary's theme for the month of July. Throughout July, our club joins Rotarians worldwide in recognizing the importance of ensuring that every mother and every child has the opportunity to live a healthy and productive life. One of Rotary's areas of focus is maternal and child health. Around the world, Rotary supports initiatives that help mothers and children access quality health care, proper nutrition, disease prevention, and life-saving medical services. Every day, mothers risk their lives giving birth, and millions of children die each year from treatable, preventable causes. At least 7 million children under the age of 5 die each year due to malnutrition, poor health care, and inadequate sanitation. To help reduce this rate, immunizations and antibiotics are provided to babies. Access to essential medical services is improved, and healthcare partners for mothers and their children are supported and trained. Rotary projects ensure sustainability by empowering local communities to take ownership of healthcare training programs. Healthy mothers and healthy children are the foundation of strong families and thriving communities. By investing in maternal and child health, we help create brighter futures and lasting impact for generations to come. And that is our Rotary Minute.
Sorry, 1 second. Deborah, I see you're busy collecting money for us, but I believe you have something, a minute that you would like to share with us as well? Yes, okay. Thank you.
Good afternoon. Give me 1 second as I find my spot. I apologize. Good afternoon. Can everybody hear me?
Yes.
Thank you. Okay. As foundation chair, I want to share some insights into what the foundation actually does. I'll share a short message each week this year about the Rotary Foundation, its programs, and how it uses your support for service projects that change lives around the world. Let's start with the words of Paulo V.C. Costa, the 1991 Rotary International President, who said, "The Rotary Foundation is truly Rotary's most precious jewel, for it transforms our most daring dreams into the most splendid realities." And thank you for supporting the foundation and its work. Well, good afternoon.
Yeah, just a display. So that's it. So the same thing is Great. Apologies, yeah, working out all of these, first stage jitters, but we were getting there, we're getting there. But thank you very much, Director Deborah, for Foundation. We look forward to hearing all of these information that you bring to us within the coming weeks.
Thank you.
Okay, so now we would like to call on our President-elect, our, Director for Administration, our Chairperson for Education and Literacy. All right, to come and introduce our guest speakers for the day, please.
Okay. Thank you so much, Sergeant at Arms Chantel, PP Chantel. It gives me great honor and privilege to introduce a beautiful woman who's accompanied by another beautiful woman. Let's give them a hand clap. Our very own RCN, Dr. Dean Wallace. And of course, she's accompanied by one of her colleagues, and when the other one comes, if she's able to make it, wait, yeah, I'll still introduce as well. Moving along, Dr. Rashawn Dean Wallace is a wife, proud mother of 3, and a physician. She currently serves as a senior house officer in the Department of Family Medicine at Princess Margaret Hospital and is chief resident for the Department of Family Medicine for the years 2025 and of course 2026 academic year. Dr. Dean Wallace holds a Bachelor of Science degree in biology with minor in psychology from Mount St. Vincent University in Halifax, Nova Scotia, Canada, and earned her Bachelor of Medicine and Bachelor of Surgery from the University of the West Indies. Wow. She also completed her diploma in family medicine with distinction and completed her Doctor of Medicine in Family Medicine at the University of the West Indies in June of this year. Let's give her a hand clap. Woo! Throughout her career, she has served in both family medicine and accident and emergency medicine and has been actively involved in chronic disease management, diabetes, education, community outreach, and public health initiatives throughout the Bahamas. Her current research focuses on the prevalence and associated risk factors of obstructive sleep apnea. Previously, I hope I pronounced that. Oh, she said I did it. She said I did it correctly. Clock. Thank you, Dr. Dean. Previously, Dr. Dean Wallace served as Service Projects Chair-elect of the Rotary Club of Nassau and Chair of the Rotary Clubs of the Bahamas Diabetes Initiative. She remains passionate about service above self, combining her commitment to medicine, community development, and volunteering to improve the lives of others. Outside of her professional and volunteer commitments, Dr. Dean Wallace enjoys spending quality time with her family, traveling, exploring diverse cuisines, and participating in outdoor activities. She would be our first speaker, immediately followed by Dr. Destiny Stewart, who is a family medicine physician in training with a passion for preventative health, nutrition, and helping individuals build healthier lives through sustainable lifestyle changes. She holds a Bachelor of Science degree in biology with a minor in chemistry from the College of the Bahamas and MBBS from the University of the West Indies and postgraduate certificate in lifestyle medicine with merit from the University of Buckingham, United Kingdom. Currently pursuing her Doctor of Medicine and Family Medicine at the University of the West Indies, Dr. Stewart has a special interest in obesity management, women's health, and chronic disease prevention. She is committed to empowering patients and communities with practical evidence-based strategies to improve their health and well-being. Outside of medicine, Dr. Stewart enjoys traveling, exploring new experiences and cultures, and giving back through community service. She believes that lifelong learning, meaningful connections, and service to others are essential ingredients for both personal growth and healthier communities. And our last speaker would be Dr. Jessica Thompson-Brennan, who is an obstetric and gynecology specialist dedicated to improving women's health through compassionate, evidence-based, patient-centered care. She practices in both the public and private health sector. She earned her undergraduate, medical, and postgraduate degrees from the University of the West Indies. Beyond clinical practice, Dr. Thompson-Brennan is passionate about educating and empowering women, particularly young women, to make informed decisions about their reproductive and sexual health. She's committed to promoting healthy lifestyles, preventative care, and holistic well-being, while encouraging women to live in confidence, purpose, and self-respect.
a devoted wife and mother of two. Dr. Thompson Brennan values the importance of balancing family life with professional excellence. Her Christian faith, nurtured through her active involvement at Revolution Church, guides her commitment to serving others with compassion, integrity, and humility. Through medicine, education, and advocacy, she strives to make a lasting impact on the health and well-being of women, families, and the wider community. With that said, we have a colorful, well-educated crew that's coming to speak to us. Let us give them a hand clap as their focus is on our July month theme, and their theme will be centered around growing healthy in a digital world. Let's give it up for our presenters for today.
Good afternoon, everyone. Can you hear me? Good afternoon. This session well. Okay, so thank you for the warm welcome. And thank you for having me. You know, I haven't been visible, but I'm hoping since that's been the end of my tenure of studies right now, that I would be more visible and more serving. So today, my topic is raising healthy children in a digital world.
Trying to figure out to take it off. It's showing your necklace. You know how to do it. I mean, this is fast. Yeah. Here, it's just because it's shared. So it's there.
I still trying to get it larger.
No, so
That's fine.
unless I go back to duplicating and then to show the show.
I'll just move this in. I need to make it small.
For you, because
This is fine. It's not even me. I have my notes. I'm just saying for those who are here can see.
the screen. Something. I'm still feeling behind this one.
Finally. Okay, so good afternoon, everyone. So my topic today is raising healthy children in a digital world. So I want to take a practical, down-to-earth look at some of what is happening today in our society. So I know a lot of our parents and probably grandparents wrestle with today's technology and how we would combat raising healthy children in this digital world. And it's absolutely saturated with so many. So everything I share is basically grounded in evidence. And so I have quite a few stats to share with you, and I hope it helps to enlighten you and help us to try and carve a path forward for our future. Let's get the next slide. Okay, so Whitney Houston, she believes that children are our future, and we all believe that, right? So we teach them well and let them lead the way and show them all the beauty that they possess inside. And we can see that, yes, technology has its benefits, but it also can be a detrimental side to it if it's not managed appropriately. Next slide. So children today are growing up in a digital environment that wasn't here about 10 to 15 years ago. All right, and while technology brings these great opportunities, excessive unstructured use is now clearly linked to a number of problems. So sleep problems, behavioral concerns, and even physical health issues. So the theme in the back of our heads is it's not about the device, but it's how we're using it, how our children are using it. Next slide, please. So here we're talking about the numbers. So physical and mental health as it relates to screen time. So 14.8% of children have been found to be obese. Those persons using screen time. All right. 41.6% of those children has at least 4+ hours of screen time. This was during COVID, and it has bumped up at least. It was originally 33%. Now it's bumped up to 41%. So from the pre-pandemic era. So mental health, so it's 2.6 times higher rate of depression symptoms that are seen with this daily increase in screen time. And there's a 2 times higher likelihood of anxiety and depression in our children once they spend at least 3 or more hours on social media. All right. Next slide. So here, yeah. So here we see that 73% of children have a lower chance of sleep quality during the screen time. And the younger they are, the more at risk that they are. But we also see a link as well that persons who had less screen time, so less than that 3 hours, they perform better in school. So their average grades were about 88.4% in comparison to students who had at least 3 hours of screen time, which was at 62.1%. So there's 9 to 10% lower likelihood of them having good reading and math scores for every hour that they use the screen time daily. Next slide. So I want you to picture the early years as a time when a child's brain is literally being wired. So during that window, they build speech, they build attention, social skills, human interaction, real face-to-face time with us. So the trouble is too much screen time, it quietly crowds out and drowns out that interaction that's supposed to be building the brain function. All right. Next slide. So one of the top things and very important is that sleep and screen time. And even not only for children, but also for us as adults, because a lot of us have sleep challenges as it relates to using devices. And essentially what happens is at bedtime, there's a blue light that's emitted from these screens, right? And what that does is it decreases the hormone in our body called melatonin that allows us to go to sleep. So that's why it's recommended that when it's time for bed, at least an hour before that, we put away devices to allow that hormone to naturally act on our body and make us sleepy. However, as a result, those children, as well as ourselves, if we don't allow that, we start to have problems with sleep. We start to have problems with concentration. We start to have problems with our mood. And all of that will be obviously affecting the children later on in the future. So this is exactly why we push so hard to reduce the screen time in our children. Next slide, please. On the physical side, we look at the sedentary lifestyle. So children are not as active as they used to be. And so this leads in or ties into our childhood obesity. Also, they're having poor posture, neck problems, back problems. They're sitting up on games, video games, playing, eye problems, right? So there's a myriad of problems and sequelae of this that we'll have to be looking at in the future. So the time that they now used to go outside and play, they are absorbed or saturated with these devices. So what our goal is, or what is recommended, is that every day a child should have at least 60 minutes of outdoor playtime, active time, away from any devices. Next slide, please. So we briefly talked about the mental and social health. So with social media, we think about it, comparisons. Children are always comparing themselves to each other when they are involved in watching the social media, and comparison is the teeth of childhood. So social media pulls kids into this constant comparison, and that slowly chips away at their self-esteem. And when you layer on top of this cyberbullying, you raise the risk of anxiety and depression. But here's the encouraging part. The strongest protective factor is what we have. We have that personal connection, that parent bond that we need to instill and foster between us and our children. So a strong communication and trying to stay genuinely connected will definitely make a difference. Next slide, please. So here we have some recommended screen time guidelines, and sorry for the font. So the American Pediatrics Academy has suggested screen times. Now, one time before, they said no screen time before the age of 24 months. So they've given some allowances as of recent. So less than 18 months, they are said that you should avoid screen time unless it's for communicating via video calls. So we know now, since the era of COVID, that has been more prominent. So they do allow them to have interactions via video calls. All right. Between 18 and 24 months, it's only if they're watching high content quality. So let's say ABC is something that's academic and it must be viewed along with the parent or the guardian. And it should not be more than an hour a day. All right. Between the ages of 2 and 5, it's no more than an hour screen time. All right. And we know everybody guilty because when it's time to babysit, the device is babysitting the children, right? And then so 6 years and older, there's consistent limits that balance the screen time with sleep, activity, meals, all of that. So it's a balanced environment. All right. Next slide, please. So us. So children mimic us, right? So what we do, they'll do, and what they feel is okay to do, they see us doing, they feel that it's okay to do. So we're going to shape our children's habits in terms of screen time. So we have to give them rules around how they use their devices. So for example, myself, my children, they're not allowed to use their devices until it's summertime on extended break. So weekends, evenings, they're not allowed to use the devices. That's a no-no. And when they do get the devices, I have it structured where you have to do at least an hour of something educational before you're allowed to. And after an hour's time, the device would lock them out. And I would have to put a code in to allow them to use it again. So there are features on devices that you can utilize and not leave them to their own devices, right? So we want to be able to watch and talk about the content that they're being exposed to. And think of yourself as a guide. Don't just ban them from doing it, but they're mimicking you. So if mommy or daddy is home watching TV, on the phone, playing a game, on the devices, that's exactly what they're going to do. So we have to be responsible as well and bring ourselves back to the good old book and paper and, that reading. All right. And setting healthy boundaries rather than reaching straight to telling them, no, they shouldn't do it. So next slide. So it doesn't have to be complicated, a simple family media plan. So no screens during meal times, no screens an hour before bedtime. All right. And then we want to swap it out for some healthy alternatives. So hobbies, want to go outside, ride the bicycle, go for a walk, play hopscotch, those sorts of things to have a balanced time. All right. Next slide, please. So let's bring it home to our context. So here in the Bahamas, smartphones, devices are everywhere, right? Across every household, across every age group. And at the same time, a lot of our outdoor play spaces are limited. A lot of us are now outside or in the city. So we're in a lot of gated communities where there's little access, and we worry about safety as well, right? But we have a strength that works for us because culturally we are grounded in family and we want to put those things together, right? And so this is where I think that Rotary can also play a huge part as well. Next slide, please. So with having this awareness and sharing the statistics with you, there's meaningful work that we can do. So parent education workshops, digital literacy programs, having proper device hygiene in our schools. We could collaborate to have safe play initiatives and mental health awareness campaigns. And so this all lines up with the Rotary mission of service above self. And so I think this is a good platform, a springboard that we can start to work on. So that's my talk for today, and little tidbits on how you can help raising your child in the digital world. Thank you. So train up a child in the way he should go, and when he is old, he will not depart from it. So you continue to be the example. Thank you.
Special.
Yes. Just keep on it. Yes, there you go. Sure. Looks like the presentation will just stick first. So you chair.
So while they're getting set up, I just wanted to give you an opportunity to ask any questions, any concerns at this time.
Are you able to give us a copy of your presentation?
Sure.
So we can share it in the chat, please.
No problem. I think that you should be able to upload it right from the job.
Oh, yes, yes, yes.
Not a problem.
I have an 11-year-old going on 12-year-old. And she is going to leave, so we child.
Okay.
She don't really have cousins her age.
Okay.
And so I am guilty of letting her have a straight A student, she graduated from private school, on principal list and everything. So I don't bother with her academics. But when I take the tablets from her, she was fully forced into a state of depression.
Right.
You give me, I mean, I've tried the timing, I've tried everything, but she has nothing else to do. I don't want her outside, because there are no children in my neighborhood either.
Okay. So I understand, and that's a realistic thing today. But what did you do at 12?
But when I was 12, we had children, I had children to play with. I'm the baby of my family.
Okay.
But my neighbors had children my age, so we would be outside till dark.
Right.
But now I find that in our neighborhood, there's one little boy and he's around the corner and he has his own siblings on the inside, younger siblings that he plays with.
Okay.
So there's no kids outside during the day.
So understood. So my suggestion, if I were in your shoes, the goal, like we say, at least aim for the 60 minutes a day to try getting some activity. So you can incorporate that as spending time with her. Right? So a time for communication, right? A time for, a time for being active. So whether that means, okay, maybe y'all live, I'm just throwing it out there, you live close by Goodman's Bay, you can like do a couple laps around the park or walk on the beach or, you know, go for a drive or do something else, right? But I think that can give you an opportunity to find out the things that she may like outside of the devices. And then some things that she's watching on there, maybe that she may want to try, like experimentation, like maybe it's baking, maybe it's cooking, maybe it's not just, you know, watching hair and nails, or even it's that you go and do a party or y'all do something together at home to make it a bit more interactive rather than her just being to herself. And then that's also a social withdrawal. So yes, she is academically sound, but what's going to happen when she now leaves from the primary into the junior high school? How is she now going to assimilate to that environment. So that may be hard for her to transition, seeing that she's also an only child. So you wanna, I'd say during the summer, find ways for her to socialize with other children, whether in summer groups, church, that sort of thing. Just to get her out, right? That would be my suggestion. All right, and so she could form those bonds with other children. Right? And you had a question, sorry.
Yeah, so but it's out down and not much. She's myself can ask like do boys love like sports and see the injections that they have first that we shot and very friends and welcome. My topic.
Thank you.
Thank you. Thank you.
Good afternoon, everybody. So thank you for having me here today. Michelle is very specific about how long I can spend talking to you guys. I don't know, she thinks I talk a little bit too much, but please bear with me. I tried to make this as short and compact as possible, okay? So today I'd like to talk about a growing public health challenge, which is childhood obesity. You know, we don't always like to talk about it, and I think we like to use the term big bone. He's not fat, he's just a little big bone. But it's becoming a major health challenge. And today's digital world is influencing the way that our children eat, mostly and grow. So while technology has brought together people and has created new challenges, it has created new challenges that will require families, schools, healthcare, and communities to work together. Let me go to the next slide, please. This slide, so yeah, that's perfect. Okay. So you see that number? That's 160 million. So more than 160 million children and adolescents were classified as obese in 2022. Worldwide. Oh. Worldwide. Okay. And next slide, please. That's a big number, right? So let's talk about why this matters and why we should really be taking this into a large consideration. Childhood obesity matters because not only is it one of the most major public health challenges of this generation, it is a chronic disease and not a character flaw. And it is strongly linked to lifelong cardiometabolic risks such as hypertension, diabetes, heart failure, and it is largely preventable, especially when they have a good environment that supports healthy choices. Next slide, please. I gave you a little bit of a picture, but I didn't give you the full picture. More than 160 million were diagnosed as obese, but over 390 million worldwide of children and adolescents between the ages of 5 to 19 are actually classified as overweight. So that means they're heading into obesity. So that number may actually be even larger. And these numbers have more than doubled since the numbers in 1990. So the problem with this is a child is more likely to remain obese into adulthood, which means earlier onset, longer time to have a disease. All right. Now, what's our reality? I gave you global statistics. Surely we can't be that bad, right? Wrong. 21% of Bahamian children and adolescents between the ages of 5 to 19 are living with obesity. The numbers a few years ago, I would say maybe as low as 10 years ago, was 7%. Adult obesity is also high, which shapes the environment in which children grow up in. So many adolescents based on studies that have been done last year, as recent as last year, has shown that a lot of adolescents, they like Wendy's, they like KFC, they like Popeyes. They do not like fruits and vegetables. I can't tell you the amount of times that I've seen adolescents come in for belly aches and they are very constipated because they do not drink water and they don't eat fruits and they don't eat vegetables. They lack a lot of fiber, a lot of nothing. Now, growing up in the digital world, apologies if you can't see it too clearly, there are challenges. And so like LaShawn expertly spoke about, there's more screen time. Sometimes when we watch the screens, how many times have you guys been on your own phones after having had a conversation with friends? You see, man, I really wanted some KFC, and you see an ad for KFC Papa. I've seen it. I've seen it. So we have a lot more food advertising. And then, you know, due to unforeseen circumstances or maybe just how the environment is shaped now, you have less outdoor play. So less children are going outside to play. And then because of the digital realm, because they're always on their games, or they're always on their iPads, they're not sleeping well because they use these things well into the night. That blue light will prevent them from going to sleep, especially if they don't cut it off at least an hour before bedtime. So now that we know those challenges, how can we fit digital use to help us create better opportunities? So, you know, there are some apps that actually have fitness and activity on them. There are also some apps that introduce healthy recipe platforms, sweet potato brownies are a few different things that actually will kind of help you get into the healthy mindset and frame. You also have active gaming. And I know like the gaming is electronic. I remember when I was young when the Wii just came out and they had this tennis app that I really loved. And without even knowing you're exercising, because by the time you hit that remote control bar, you actually would have done some movement. So that's a way that we can use digital, you know, digital things to actually help us get into the motion of movement. And another thing is you have some apps that can actually tell you, hey, it's time to drink water. You haven't drank any water today. Hey, it's time to move around. It's time to stand up. It's time to be active. So we can use the digital world to our advantage if we know the information. So now that I spoke about the stats, I want to talk about what happens now that we know that there's a problem. What consequences, like what are the things that we have to be wary about when it comes to childhood obesity? Much like adult obesity, there are health consequences. So it actually can affect all of your systems, the cardiometabolic system. There's a higher chance of a child developing type 2 diabetes, hypertension, and dyslipidemia. There's a chance that it can affect the liver and sleep. They can develop fatty liver disease. They can have obstructive sleep apnea. Even because of the way it can cause wear and tear of the joints. So a lot of children may actually have osteoarthritis. They may have an ability to actually do a lot of the physical things you would expect a child of their age to be able to do. And also, when it comes to mental health, especially if they're morbidly obese, they may be the target of bullying. It may cause them to have low self-esteem, anxiety, and depression. That can be prevalent in our society, especially with social media the way it is now. And long term, they don't stay children forever. They grow to be obese children and grow to be obese adults. And they will have even more of those effects as they get older. So this slide here I put as a case to actually show you that this is real. In Michigan this year, there was a 7-year-old child with severe obesity. He weighed 255 pounds when he died. And how does a 7-year-old weigh 255 pounds? It's because his parents fed him a diet that was largely chips and sodas and McDonald's and KFC. He didn't get a nutritious meal. He didn't get time to exercise. And what happened is he developed life-threatening heart disease. And he died despite a potentially preventable condition. And so why I put this in is it tells us that there's a problem And I want us to be able to recognize it early. And if we can recognize it early, prevent it from happening. I will say that some people would say, you know, in the Bahamas, we don't really see a child that big. We've never seen a child that sad. But I will tell you from experience that I have seen a 13-year-old that was 500 pounds. Yeah. I've seen 13-year-old that's 500 pounds. I've seen 12-year-olds be as high as almost 300. And so we do have a serious problem in this country. And so now that we are recognizing and we're being told that there's a problem, how do we fix it? So, next slide, please. Prevention starts early. So this is a nice little timeline I want to show you. It actually starts from before a mother even has a child. So studies have shown that once the mother has a healthy maternal weight, she keeps herself in, you know, good nutrition. And even if she develops gestational diabetes, once it's managed well, it starts from there. And within the first 1,000 days, so from birth to 2 years of age, if the mother is able to breastfeed, now I will say that we shouldn't stress mothers that can't breastfeed, because sometimes the breast milk may not develop, but whatever little drop is important. Also healthy complementary feeding, so you can't breastfeed, but what can you give them? You have to look for the best formulas and also make sure, you know, everything, whatever they're able to get, and when they start foods and when they start solids, what are you introducing them to? I know back in the day, my mom introduced me to a chicken drumstick, right? So we could do the chicken drumstick as long as we do the lettuce and tomatoes and all the vegetables, all right? And also monitoring their growth. Early childhood, healthy family meals. What are we cooking at home? What are we buying when we're out? Are we introducing them to a healthier diet? Also, are we letting them play outside? Are we letting them play with the neighbors, run up and down? Are we telling them to sit down and watch TV? What are we telling them? Also, good sleep habits. We have to shut down that device. Your bedtime is 8 o'clock, by 7 o'clock it should be off. And also, like Lashawn expertly mentioned, limiting screen time and what they are allowed to watch. Okay, age is school age, daily physical activity. So I know at school they have PE. How often you have PE? Once a week. Once a week, right? You know what's easy? Everybody as a family can actually go outside in the evenings. Okay, let's walk together as a family. I feel like that encourages good relationship and good communication, because you get to find out their interests aside from having conversations. I don't know if you all ever tried talking to an adolescent, but that's very difficult to do unless you get them a little bit relaxed and loosened, because they are very tight-lipped about everything. And so also supporting healthy digital habits and ongoing family support. So keep it up as a family and you likely get to your desired goal. So what's the action plan? So it actually should be spread upon, you couldn't say that everything falls on home, but healthy home is one of the major parts of the plan. Helping to choose water over sugary drinks, eating balanced family meals, encouraging daily active play, and getting healthy screen time limits. Let's talk about healthy schools. I think we should make it a mission to target, just like how we have the breakfast program. If we were to talk about school lunches or lunch vendors, probably encourage them to make healthier foods, adding a vegetable here and there, maybe even disguising it. Encouraging daily physical activity, not once a week. Also, nutrition education is important. And in addition to that, maybe supportive school environment. I know I went to SAC, and so we had blocks, and we had different things to do afterwards. But even in terms of maybe one of the blocks in school, that's something physical, something in that nature. That's something that we have to probably look and advocate for. And then we also want to talk about healthy communities. Safe parks, recreation, access to healthy foods. I know things can be expensive, but what I love is that we have the farmers markets in different areas. We can get fresh fruits and vegetables that may not be as expensive as the food stores, but you do have access to that. And they're open on the weekend, especially the one out Gladstone Road. Access to healthcare screening and family support. So we as doctors probably could support the community a little bit more by maybe quarterly we get a talk every quarter and try and do more than one area of screening. And so all these things can actually help prevent and lower the numbers as it pertains to childhood obesity. So my key take-home messages would be that prevention starts early. If we encourage healthy habits before birth, then we are likely to reach our goal. Also, the digital world matters. So balancing screen time with active play and healthy habits need healthy environments. So healthy choices should be the easy choice. And every small change counts. So small daily habits build up over time. So thank you. I hope I was. You guys have any questions for me? All right, thank you very much for having me.
That's you?
Yes.
Okay. Good progress. Pull up the mic.
I didn't close it on mine. Hello.
Oh, did it go on?
Yeah.
Battery died.
Yeah.
Oh, it's bad. Hold on.
Yeah, I'm sorry. Hello, hello.
Yeah. Oh, there you go.
It was off all the time.
All the time. Oh, my goodness.
But you can hear, I can hear.
Yes, yeah. You've heard have speakers. There you go.
All right. Okay, a pleasant good afternoon, everyone.
Good afternoon.
I am Dr. Jessica Thompson Brennan, OBGYN. And my talk today is going to be on empowering lifelong women's health in the digital age, okay? I'll try to keep it brief because I don't want to bore anybody, okay? So let's move on. I want to thank you all for joining me today, and I'm so happy to be here in front of such a lovely group of people. So when people hear the phrase women's health, they often think about pregnancy or reproductive health. While these are certainly important, women's health encompasses so much more. It includes your physical, emotional, sexual, as well as mental well-being throughout every stage of a woman's life. So one of the most empowering things a woman can do is to prioritize preventative health care. And this usually comes in the form of regular checkups, which allow your physician or your healthcare personnel to detect problems early, prevent disease, as well as provide education that helps women make informed decisions about their health. So today, what I would like to do is just to take you on a little brief overview of the different stages of a woman's life and to highlight some of the most important health considerations at each stage. So I see that we moved on to the next slide already. It's okay, it's okay.
I thought I'd be proactive.
No, that's good, thank you. All right. So we're starting with our early reproductive years, and this is typically between the ages of 13 and 15. And believe it or not, the first visit to the gynecologist is recommended during this time. How many of us went to the gynecologist at age 13? 15?
I was 18.
18? You did? Yes. Awesome. I congratulate you, because that is what is expected. All right, believe it or not. And many parents believe that, this is when we need to do a physical examination, inclusive of a pelvic examination. But believe it or not, that's not necessary. At this stage, this initial visit just involves, you want to gain trust in the patient. You want to educate this young adolescent woman who is moving into adulthood. You want to make her comfortable with seeing her healthcare provider. So during this visit, we also want to discuss the physical and emotional changes of puberty, menstrual health, healthy relationships, body image, and answer any questions about her sexual health. Because those hormones are raging. She's starting to feel these things that she's not felt before. She's seeing these things in front of her chest. She's seeing blood in her underwear, and she has a lot of questions. So these are the time when we want to make sure she gets as much informed decision, much educated, much education as possible regarding these particular stages that she's going through. So we also want to, at this point in time, provide education on sexually transmitted infections, as well as any unintended pregnancies whenever appropriate. So these conversations are conducted in a respectful as well as a confidential manner, allowing young women to ask questions that they may feel uncomfortable discussing elsewhere. At the same time, we want to encourage open communication with parents or trusted adults whenever possible. So this first visit essentially provides a foundation for a lifelong or lifetime of strong healthcare habits, right? So moving into our reproductive years. So this is the years that we expect something to be happening, some pregnancy to be going on, right? So at this point in time, you want to establish that this patient gets annual visits. These appointments are much more than just your pelvic examination. They also provide an opportunity to discuss general, mental, as well as sexual health, contraception, nutrition, exercise, family planning, and any concerns that a woman may have at that point in time. So one of the most important preventative tests during this stage as well is our cervical cancer screening. That's it. So women should begin pap smear screening at what age?
21.
That's it, 21, and that's regardless of when she became sexually active, all right? So the pap smear, what is the pap smear? It detects abnormal cells of the cervix before they become cancerous, allowing treatment long before cervical cancer develops. I tell people all the time, particularly my women who I see postpartum, you want to ensure that you get your pap smears because you don't want to live with cervical cancer. Like, one, it's a preventative cancer, and two, the smell is atrocious. All right, it is very ungodly, and you don't need to progress to that because there are preventative measures. Yeah, it is what it is. It's the reality of what it is. All right, and it's a preventative thing. So depending on a woman's age, medical history, as well as also any sort of her previous results, then her previous medical history and previous results, screening is typically recommended every 3 years. However, I always tell people in our population, we have a rising number of cervical cancer cases, and particularly in our younger age groups. So here in the Bahamas, we don't really follow the 3 years, every 3 years. We usually recommend annually agreeing because we find that if we allow patients to come back 3 years, guess what they can do? Come back in 6 years, come back in 10 years. And by then, what could have been prevented, it's too late. All right. So another important habit is breast awareness. And that's something we want to educate patients about at their visits. So women should become familiar with how their breasts normally look and feel. While formal monthly self-breast examinations are really no longer universally recommended, even though I still tell my patients to do it, knowing what is normal makes it easier to recognize changes that may become more apparent, like a new lump, skin dimpling, nipple discharge, or persistent pain. All of those things are not normal. So any new breast changes should be assessed by a healthcare provider promptly. And also you should be getting your annual mammograms beginning at age 40. And when do they stop? Never. Okay, never. All right. All right, good. I'm happy you know it. Yeah, you don't like it. I don't like it either, but it's a necessary evil. Mental health is equally important during these years. Anxiety, depression, stress, and burnout commonly affect women during this particular stage because they're balancing their careers, their relationships, and family responsibilities. So mental health deserves the same attention as physical health, and women should feel comfortable discussing emotional concerns with their healthcare provider.
So moving on to pregnancy and antenatal care. So for women who do become pregnant during this reproductive stage, early antenatal care is one of the most important steps toward achieving a healthy pregnancy. Women should schedule an appointment with their OBGYN or healthcare provider as soon as they have a positive pregnancy test. When? As soon as they have a positive pregnancy test, not when they start feeling baby. All right. So early assessment confirms the pregnancy. One, it establishes an accurate dating. The earlier we scan you, the earlier we can date, the more accurately and precisely we can give you a due date. This also begins, it allows for early assessment of screening tests and identifies any medical conditions that may require the patient be closely monitored, okay? This is especially important for women with pre-existing medical conditions, hypertension, diabetes, renal disease, thyroid disease, all right, sickle cell disease. All of these are diseases that are more, can be affected by pregnancy and can affect the pregnancy itself and should be monitored more closely, as well as patients who have had previous pregnancy complications. You have patients with previous cesarean sections, those with history of bleeding post-delivery, heavy bleeding post-delivery. Those are the things that you want to make sure you address earlier on in the pregnancy and inform your healthcare physician about, healthcare team about, sorry. Early management significantly improves the outcome of both the mother and the baby. So throughout pregnancy, regular antenatal visits monitor the baby's growth, screen for complications, provide vaccinations when appropriate, and offer nutritional guidance and prepare mothers for labor, delivery, breastfeeding, as well as the postpartum period. So moving on to your perimenopausal years. That's where some of us in this group fall into, right? Perimenopause. So I don't worry, I got y'all too. So as women enter their 40s or even their early 50s, this is when they begin the transition into menopause. And this is the whole term that we use for this is called perimenopause. That transition period is perimenopause. So during this time, you have hormonal levels fluctuating, menstrual cycles becoming irregular, your fertility gradually declines, and women begin experiencing symptoms such as what? Hot flashes, mood swings. You have night sweats, sleep disturbances, weight gain, your vaginal changes, vaginal dryness. You don't want to have sex anymore or something, you know, of that nature, or having problems, dryness, because of the dryness, you can have pain with intercourse. Or you could also have difficulty with concentrating. And all of these things are real symptoms women complain about all the time. So although they are common, they should not be simply accepted as something we must live with, all right? There are many safe and effective treatments that are available for all women, all right? You can just visit your OBGYN or your healthcare personnel and let them know what these symptoms are, and we can prescribe medications that can help you, all right? So regular health visits during this stage are also an opportunity to assess cardiovascular health, maintain a healthy weight, review bone health, and continued recommend, which will be a routine cervical cancer screening. Moving on to our postmenopausal years. We got you. Menopause is officially reached after 12 months of consecutive months of no menstruation. So at this stage, estrogen levels remain consistently low, resulting in long-term changes throughout the body. One of our biggest concerns after menopause is bone health. What happened? Why do we have bone disease? Because estrogen, the lower estrogen increases the risk of osteoporosis, making fractures more likely. Women can protect their bones through adequate calcium and vitamin D intake, regular weight-bearing exercise, avoiding smoking, and you want to limit excessive alcohol and caffeine consumption. Yeah, these are the things that we can do. These are easy things that we can do just to protect our bone health.
Those are too easy for some.
So what is excessive caffeine intake? More than 4 cups a day. Excessive alcohol, more than 2 cups, 2 glasses. a day. Or even a week. So heart disease also becomes increasingly important after menopause and remains the leading cause of death among women worldwide. Maintaining healthy blood pressures, cholesterol, blood sugar, regular physical activity, and a balanced diet can significantly reduce your cardiovascular risk. So believe it or not, the low estrogen levels also affect the heart. Women should also continue recommended cervical and breast cancer screenings, and pap smear should be continued up until. No, that's the only thing, not the mammograms, it's not like the mammograms in that regard, but that's up until age 65. And women, at 65, we give you a break after 65. Right. That's the recommendation. What happens?
What in the world? Speak to yourself, then.
But yeah, that's the recommendation. Right? And that's in women who still have a cervix. Finally, one more message that cannot be emphasized enough. Any vaginal bleeding after menopause is abnormal. Anything, any spotting, any little trinkle, nothing. I only see blood for one day. No, if it's after the period of menopause, it is abnormal. So while there can be many benign causes or non-cancerous causes, postmenopausal bleeding is often a sign of endometrial cancer or other conditions that should be evaluated promptly by your healthcare professional OBGYN. So in conclusion, women's health is a lifelong journey, not something that begins with pregnancy or ends with menopause. Can I get my last slide? If I could leave you with 4 key take-home points today, they would be: first, don't wait until something is wrong to see a healthcare provider. Prevention is always better than treatment. Second, stay up to date with recommended screenings, including your cervical cancer and breast health evaluations. Third, you want to seek early antenatal care if you become pregnant, particularly if you have an pre-existing medical condition. And finally, menopause is a natural stage of life, and no woman should feel like as though she has to suffer in silence. Effective treatments and support are available for each and every woman, okay? Remember, by investing in our health throughout every stage of life, we give ourselves the best opportunity to live longer, healthier, and more fulfilling lives. So I thank you for your time. Oh, last thing, healthy women create healthy families. Okay. So thank you for your time and your attention. I'll be more than happy to take any questions at this time.
Thank you. I have 2 questions.
No problem.
When did menopause start?
Menopause, typically the average age is around 51 to 52, 51.45 or whatever, but 51, around there, that's the average age. It can start much earlier and it can end much later, but that's the average age.
It can start. And then how am I saying it too? It can start, but I had hysterectomy too. Right?
Yes, so so that's the natural menopause age is 51, but you can have surgically induced or other conditions that would precipitate menopause much earlier.
Oh, wow. That's the first thing. And, okay, next question, the last question. How is it that you can see a menstrual cycle and be pregnant?
So everybody is different. We do have people that do say that they have a regular period, normal period, but that's not the norm. That's the minority of people. All right, but it really is a matter of hormones. It's the hormones. It really is. That's really what affects it. Yeah. But that's very much the rare group of people. And for some people, see, it's hard to just answer that blanket statement because it may be another issue. It may not be period. It may be an issue with the placenta that's causing you to bleed. It may be an issue with a polyp that's causing you to bleed. So there may be other reasons within the pregnancy that may be causing you to bleed, not necessarily a period.
Oh, I asked that because that happened to my first child. And I asked Dr. Brooklyn, he can figure out either. So I had to ask the question again.
No problem. But yeah, I guess you have more than one child?
I have 3 kids.
And it only happened with one?
With the first one.
So it may be the hormones or Or it might have been, like I said, the placenta or something like that. Yeah. Any other questions? Any questions? About menopause, something? Nope. You said 51, right? Yes. Listen, that's the average age. Don't hold me to it. Thank you all.
Yes, thank you so much for our three presenters. Great information from all of you. And we'll now call on our Samita to come and do our vote. Thanks.
Thank you, VP, Sergeant at Arms. I'm gonna call for Doctors Roshan, Jessica, and Destiny. Can y'all come forward, please? To the front. Let's give them a hand clap. We thank them for their patience as we were trying to set things up, but we know how things normally can go during initial meetings. So we are very grateful that you all have extended your time out of your busy schedule to come and be here with Rotary Club of Nassau. Give them a hand. But of course, this is a club that thinks out the box. So I've put on the spot a young woman who is in our midst. I knew her from she was a toddler. Her and my daughter are very, very, very good friends. She's going to teach me how to swim soon. So Renishka is the guest of course, our membership director, Jamie. And I need you to come forth because I put her on the spot and we think out the box. And she's going to say the official thank you. Okay? That's what she's gathered for today.
Okay, so on behalf of everyone who presented, I would like to extend sincere thanks to all of the speakers for taking the time out to share such informative and meaningful presentations. The discussions on maintaining a healthy lifestyle in today's society where screen time is increasingly common were both insightful and relevant. Learning about important topics such as mental health, obesity, women's health, and the importance of making healthy life choices has given us valuable knowledge that we can apply to our daily lives. I especially appreciate the practical advice that was shared, and I look forward to passing on the information to my little niece and nephew as they grow. Encouraging healthy habits from a young age can make a lasting difference, and I hope to help them develop a balanced lifestyle both on and off their screens. Thank you once again to all the speakers for your time, dedication, and commitment to educating and inspiring us.
She was listening. Thank you very much. Photo, please.
While we're getting the photo directed, can I ask you to sell some more raffle tickets, please? I'm sure about 5 more people came in. Okay. You know, make sure we raise some good funds this year.
She said she wants to buy a raffle.
Oh, there we go. Awesome.
What is it?
See if I get my hands. No problem. So Deborah, we need some tickets sold up here as well. All right. So while she is doing that, Madam Secretary, I know we are short on time, but we got to get at least 3 fines in. And I would like you to help me collect fines starting with you. Where's your pen? You just got your pen last week, Tuesday. Hello? Madam President-elect, I know you got some pens today. Where the pen you got last week, Tuesday?
Right here.
The one from last week, Tuesday, not the one we gave you today. You didn't have it when you came in. Where you find it?
Do you want my glasses?
Anyone else missing pens? No, not the pens what you just got. But you don't know. Okay, all right then.
I got fast.
Here we go. Treasurer came late.
I came out of my bed.
Oh, you came out your pen.
Yes, I just got it today.
Okay.
Last week.
Okay. But we can still accept your donation. Thank you very much. Thank you very much. Yeah, so just a couple. Look, why your hands swinging? No, what's happening? Fines. Oh, thank you very much. You paying for you want raffle tickets or you paying for coming late? Which one? Raffle tickets. You always get the winning ticket. Yes.
I'm a late drop.
Ah, there you go. All right, I'll make sure Deborah come over there to you. So Larry wants to purchase the wedding ticket again, okay? All right, thank you. All right, so while we are waiting for the more of our tickets to be sold, Madam President, would you like to have any closing words with us before we do the raffle? Since we're still selling some raffle tickets? That's the wrong answer. I need something to fill the void while we are waiting to sell some tickets.
Invite membership.
Yeah, online? Any comments? Anything you'd like to share while we're selling our last few tickets? Are you still there? Can we have you turn on your camera, excuse me, to confirm you're still there? Oh, jeez. I think they may have moved on. No, that don't sound right, but anyways. All right, how we looking? You almost done? Don't forget Larry will get this winning ticket. Thank you. You got your ticket, Derica? I know you bought the prize, but you get a ticket too? The prize, you should buy a ticket to win your prize.
The part that upset me, I understand that.
Yes, that's how it works.
Oh, okay.
Yeah, it's all for charity, all in a good name. Thank you. Appreciate it. All right, everybody's good now? So everybody's good? Nobody want to share some words while we waiting for these raffle tickets? How about you, Madam Membership Chair? Who's that? Sorry, I can't, I don't have my glasses on, sorry. Can somebody read, can you come read that for me on, no, come see the laptop right here. You can see it. Oh gosh, almighty. This is crazy. Samita, you have you on the chat? Let's see. All right, I just see Charlene is making a comment, 3 excellent presentations. Karen is happy to be here. Laverne, unfortunately, is having audio challenges. Oh. Yes, okay. You good to go? Almost there. Yes. You need to let our Olympian over here pick the ticket. Oh. Rolling. All right, good. All right, awesome. Let's take over there for a few. Beyond. Yes. Yes, Madam Treasurer. Treasurer, hello, Treasurer. Yes. I'm sorry. All right, yes, can you pick a ticket for us, please? Thank you. See, we put you on the spot. This would happen when we have celebrities and I guess. See? Oh, I like that. Not even looking at the numbers. Excellent. Very fair. All right, let's see. What we got? Is that my number? Take your ticket first.
383707.
Oh no. 383707. Narita, can you please come and present? Let us know what the raffle prize is, please, and you can present. Exactly. Okay, thank you. No, yeah, this. Oh, are we doing two? Yeah. Yes. Oh, sorry. Okay. Well, we need to present. We get a little camera so we can pass it to our. Yes, thank you. Yes. You young enough to big man?
I am old enough.
Ah, okay.
Okay, just making sure.
There you go.
Awesome.
At your young age.
Yes. Oh,
I know.
photo.
Oh,
Give me the photo.
sorry. We talking my stomach. Hold on.
All right.
Thank you.
Then Madam President, pick the next ticket, please. Thank you. Don't pick your own ticket now. All right, here we go.
And the winning number
Is
383691.
yes. Ooh, I'm 685. Who want to go? Awesome. Excellent. Your guest one. So, who taking me? 18. Y'all come take a photo, please. Yes.
When you come to RC and you get changed, huh?
Right. All right, awesome. Thank you so much. Rotarian Danny had to leave, but the four-way test, if you can all stand for a please, so we can do our four-way test. Of the things we think, say, or do, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? And let me fun. Yes. Treasurer Catherine, can you give us our Rotary toast, please?
Parents and guests, can you kindly raise your glasses as we toast Rotary around the world?
Rotary around the world. And with that, we can depart our company for today until next week. Thank you. Thank you. Right, that's right, because I know I was there. Yeah. That's right. That was it. Signing as a Rotarian, thank you. Melanie, I think we need to here too. I forgot to sign it, Rashan. She is a member.
She's there. She's on there.
She signed.
Someone wrote in.
Okay, I know I did. She wrote me in.
It's true.
Oh my God. Hey, square. You know what I'm square? I'm square, yeah. There's one there. Oh, okay.